Hey everyone, what is up? What is up? What is up? This is Julie here and welcome to my YouTube channel. Hey, look guys, if you have not yet subscribed to my channel, please smash that subscribe button, kick the like button on this video and all of my other videos. And don't forget, ring that notification bell so you'll be notified whenever I upload new content. Guys, this is my second official PROMETRIC video. Yay! All right, and it is my second official GoPro video. The reason why I'm recording most of my videos now with my GoPro camera is to give you the opportunity to watch me performing this skill or skills in my point of view or my perspective. I think that will help you out a little bit better because you'll be able to see more clearly how I'm performing each step, okay? So, without further ado, let me tell you what skill I'm getting ready to perform for y'all. It is the PROMETRIC testable skill, empties urinary drainage bag and measures urinary output. So it is actually a two-part skill, okay, that you may be required to perform during testing. So what I'm going to do is I'm going to include all of the opening procedures, the during procedures, and the closing procedures, so you can see exactly how you need to perform this skill during testing. All right, guys, I'm not going to, hold y'all up any longer. We're going to go ahead and get started, okay? Hi, good morning, Mrs. Jones. My name is Julie. I'm your CNA, and today I'll be emptying your urinary drainage bag and recording your urinary output. But first, I'm going to do a brief safety check. I just want to make sure that your bed is in a low safe position. Your bed wheels are locked. Here's your call light. If you need me for anything, you can just press this button here. I'm going to provide you with privacy by closing your privacy screen. Now I'm going to go wash my hands and gather my supplies, and I'll be right back, okay? Now guys, listen, the supplies that you will need to gather will be 1 pair of gloves, 2 alcohol preps or wipes, a protective barrier, and a measuring container or graduate, okay? So that's 1 pair of gloves, 2 alcohol preps or wipes, a measuring container, and a protective barrier. Now for your protective barrier, you can either use a Chucks or a towel, okay? So let's go ahead and collect the supplies. The first supply item I'm going to collect are my gloves, and I'm going to put my gloves on. And the reason why I'm putting my gloves on before I collect the remaining supplies is because I will be touching a container that has contained body fluids, okay? So I'm gonna put my gloves on first. Now I'll collect the remainder of my supplies, which will be 2 alcohol wipes, the measuring container, and for my protective barrier, I'm going to use a Chucks, but again, you can always use a large towel, okay? So the next thing I'm going to do is open my protective barrier. And when I'm opening it, I'm going to make sure that it does not touch my clothing, okay? There we go, okay? Now I'm going to place this protective barrier underneath the drainage bag like so. Okay, I don't know if y'all can see that. So there you go, it's underneath the drainage bag. Now I can set the remainder of my supplies down here, okay? Now you can squat like I'm doing, or you can kneel on your knees. If you kneel on your knees, you need to make sure that your knees are also on the protective barrier like mine, okay? Just like mine. All right, so the first thing that I'm going to do is make sure, or not make sure, but the first thing that I'm going to do is prep my alcohol pads by opening them up and just placing them back on the package. Okay, like so. Then I'm going to check the clamp on the tubing to make sure that it's closed. If it's down, you know it's closed. If it's pointing up, let me see if I can do this. If it's pointing up like this, I hope y'all can see that. That means that it is open, and you see how the urine is draining. At that point, you do not want to take that tube out, okay? So you'll want to close it first. Make sure the clamp is closed so it will be down before you take the tubing out of the holster, okay? It's a good thing we had that protective barrier down, right? So now I'm gonna take the first alcohol wipe, and I'm going to clean the edges of the tube like so. And then I'm gonna place this down and just move it away from me. That will let me know that I've already used that wipe and not to use it again. Then I'm going to place the tube in the measuring container, making sure I do not, or the tube does not touch the inside of the measuring container. Then I'm going to open the clamp and I'm going to allow the urine to drain, okay? Again, you want to make sure the tubing does not touch the insides of the measuring container. I'm going to go ahead and milk the drainage bag to make sure I get all of the urine out. Once all the urine is drained, I'm going to close the clamp. I'm going to take my second alcohol wipe, and like I did in the beginning, I'm going to clean the outer edges of the tube. I'm gonna place that one alcohol wipe down, and now I can return the tube to the holster. Then I'm gonna go ahead and perform my closing procedures. Mrs. Jones, I've just emptied your drainage bag. Now I'm going to measure your urine. I'm just going to do another brief safety check. You still have your call light in your hand. Your bed is still in a low safe position. Bed wheels are locked. Privacy is still maintained. All right, Mrs. Jones, I'm going to go measure your urine now, okay? So now what I'm going to do is remove my used supplies. I'm going to roll the protective barrier away from me and pull it towards me as I do so. Now, if you use the chucks, you'll want to dispose of your chucks into the trash can, okay? If you used a towel as your protective barrier, you'll want to place the towel in the soiled linen hamper, okay? Do not place the towel into the trash can, okay? Dispose of it into the soiled linen hamper. So now you've just completed the first part of this skill, okay? Emptying the urinary drainage bag. Now you'll perform the second part, which is actually measuring the urine. So what I'm gonna do is I've placed the measuring container that has urine in it on a hard surface, right? So I have it on the designated dirty table. You need to get at eye level, okay? So you'll have to squat, okay? Bend your knees and squat to be at eye level, making sure you do not place your knees on the floor, okay? Then you'll want to measure. Again, the measuring container is measured in increments of 25. So each tick mark is 25 milliliters. If your urine falls in between two tick marks,